All right. Good afternoon, everyone. Thanks so much for joining us today. My name is Mallory Denemy. I'm an account manager here at Medaptis, and I'm joined today by Jacqueline Corbett. She leads our product and solution design for Medaptis Assign. Jacqueline will be walking us through the demo portion. And the real highlight today is that we've got Chad Robertson from Texas Health joining as a guest speaker. Before we get started, just a bit of housekeeping. Everyone is muted. Please drop your questions in the chat as they come up, and we will leave time at the end for Q&A. All right, so let's get started. Okay, so today we're going to be introducing the Assign Daily Snapshot. This is a new module that addresses what needs to happen after your morning assignments are made. Specifically the task of getting those assignment updates and any pertinent information out to your teams. For our agenda, we'll start by hearing from Chad at Texas Health. We've got a few questions for him. We will have a demo of the daily assignment summary in Assign, and then we'll wrap with Q&A. And before we officially kick off, I would like to just give a bit more color on what we will be showing you for anyone who might be hearing this for the first time. The daily assignment summary is a screen within the assigned solution that displays a report. And this report helps take the manual, time-consuming process of sharing finalized assignments and basically just makes it far less involved for your list makers. This is a new module, and when it is released later this month, it will be a menu item in Assign that you can opt to have enabled for everyday use after your daily assignments are officially approved. All right, so now I'd like to introduce Chad officially from Texas Health. He is the Director of Operations, so he oversees the assignment workflows and that communication that happens post-assignment at the Texas Health facilities. And I do just want to add, before we ask Chad a few questions, that this module was the result of Texas Health coming forward with this as a pain point. Chad's team identified this need for a more efficient way to compile assignments for consistent sharing across their teams. So Chad, thank you so much for joining us today. We're excited to hear from you. And I'd like to just start by giving you the opportunity to kind of introduce yourself, tell us a bit about your background, as well as anything about Texas Health that you think is important to share.
Oh, Chad, it looks like you're muted.
Oh, I'm guessing I got auto muted. So sorry
Oh,
about
there you
that.
go.
So my name's Chad Robertson, as Mallory mentioned. I've been in the healthcare arena for about 20 years. About 10 years or so have been with Texas Health Resources. Texas Health Resources is in North Texas. We have about 29,000 employees, 420 access points, 29 hospitals. So good size organization. I work specifically for the professional side of Texas Health Resources, which is called Texas Health Physician Group. We have about, last count I saw, about 1,200 providers. Most of those are physicians, but about a third of them are APPs, maybe about a quarter. And I am over the hospital medicine service line for the east side of the DFW Metroplex. I think that kind of covers basics of our organization.
Yeah, that's great. Thank you so much, Chad. We really appreciate your partnership at Medaptis. So now I'll move into the operations specific questions. We've got 3 questions kind of before you're off the hot seat here. So Chad, after assignments are approved, what's your current process for getting those updates out? So can you kind of speak to who owns that and what makes it a painful process in its current state?
Yeah, so currently it's our night advanced practice providers that take on the role of sending out communication to all of our physicians working about what the assignments are and what's happening in the hospital. We have Medaptis being used at our hospitals that run a census of about 150 to upwards of 650 patients. So when we communicate out, we want the group to know what's going on in the hospital, how many admissions are coming in, how many of these patients have had H&Ps completed by the night group, how many are still pending admissions, all that type of information. So that they're taking the information from Medaptis and they're typing an email. So they're taking the counts by provider, putting that in there. They're putting cross coverage notes. a list of all the patients and the assignments of who's picking them up that need the H&Ps completed. And for those cross coverage patients, they're pointing out any patients that are deteriorating or any other notes that the daytime physician needs to know about in order to make sure they know how to prioritize their schedule for the day.
Great. Thank you, Chad. That's a great answer. And you've kind of touched on this second question, but I'll just ask it anyway in case there's something more you'd like to say. Can you speak to why it's important for the teams to have this information and what happens when it isn't shared clearly or consistently across the facilities?
Yeah, I think the most helpful thing from our physician standpoint is helping them prioritize what patients need to be seen first. When you get to come into a list of 16, 18, census is up 20 patients, where do you start your day? So really, we've kind of prioritized three different areas that we want them to focus on. And that's being H&Ps, patients that haven't been seen. They may have been admitted at 10, 11 o'clock at night. And if we're really busy, we just haven't gotten a chance to see them. So that's a priority. Discharges from a patient throughput standpoint and length of stay standpoint, we want to get the discharges out. Anyone that's safe to go home we need to get those orders in. And kind of the third area is any patients that have deteriorated overnight, any type of critical issues going on with patients, anything like that, they need to address first. So it's really important they get that information. If they don't get it, there's the one potential for increased length of stays, but probably more importantly, and it is more importantly to our organization, is ensuring that we don't have any gaps in patient care, delays in patient care that may result in patient safety concerns. And some of the pain points, I think you asked about pain points, and I didn't answer that. I think the biggest pain point we have with typing up these emails is just the time and human error component. And it's really that human error. We've had times where our APPs are trying to rush and get all this stuff in a manual email, but they may put the wrong doctor next to the information on a patient they're not seeing. And it gets confusing if a doctor reads this, thinks it's someone that's high on the priority list, and when they get into Epic, find out it's assigned to somebody else. It just creates confusion. So what we're excited about with this rollout is it'll take away some of that manual typing of patient information with those cross coverage notes.
Makes sense. Thanks for that answer. That's great detail. The last question we have for you, Chad, is just as sort of a phase two, knowing that this is phase one of the assignment snapshot, what do you envision? How can we help improve this process even further moving forward?
I think the biggest thing that I would love to see is a way to automatically send out the communication to our physicians electronically from a sign. I mean, if there can ever get to a point where we can send out a HIPAA compliant communication via email to our doctors directly from the system, it would just save that extra step of having to copy and paste. Not a major deal, but it would be helpful. I was thinking about this earlier today as well. And, we treat our observation patients a little bit differently than our inpatients. So that's another thing that in kind of a phase two, we may want to try to break out or spell out is those observation patients that are, have passed the 24-hour mark, approaching the 48-hour mark, because it's important to us as an organization to either upgrade them to inpatient or discharge them prior to that time. So I think there's a lot of potential in kind of a phase two. What other things can we look at to make this even more beneficial than we think it's going to be for us?
Great. Thank you, Chad. We really appreciate you answering these questions and just giving people some context as to why we built this module. So really, really thankful that you were willing to share how it looks in practice for Texas Health. Now we'll shift into the product demo. This is sort of the second piece of our agenda. Jacqueline, I'll hand it over to you to walk through the daily assignment summary screen and report.
Thanks, Mallory. So I'm going to start by talking about the daily assignment summary screen. As Mallory mentioned, the screen is used by the person who is creating and sending the report to the group. So once your assignments are done and approved, you would just come to this daily assignment summary screen, and it will automatically populate all this data from the day's assignments. The screen is broken down into 3 sections. You have your top section up here, the provider summary. the middle section, the indicators and patient callouts, and your bottom section, the crossover notes. What is nice about these sections is a site can choose which ones they want to use. So we can configure this to have 1, 2, or all 3 sections depending on their needs. And I'll go into a little more detail about this as I go through the sections. So starting at the top, this section, again, the provider summary. This data is populated from the approved assignments and answers the key questions that we have found that most groups want to know in the morning. So who is on? Does the day look balanced? And how are certain patients assigned? So you can see that we have the date, we have the total patient census. We show you who the providers are that are on schedule for the day, what coverage slot they are working, and also the total number of patients assigned to each provider. So at a minimum, a site could just use this section as it gives teams a quick look into the assignments for the day.
Thanks, Jacqueline. And Jacqueline, if I can just jump in there, I think something that we wanted to just say to this group is, as we've talked to customers, they have been telling us that this section alone will save them a lot of time rather than having to type it all out. So I just wanted to stress that again as we walk through this.
Yeah. Also, in the provider summary, in my system, you can see that we have a couple additional columns. And Chad kind of mentioned his sites, like what things they are interested in calling out. In my demo system, I have ICU downgrades, I have consults, and I have H&P needed. So these indicators are configurable per site. So whatever types of patients that your group wants to call out, we will be able to build that into your system. So if your site is choosing to use those indicators, you will have this middle section here. This is the patient indicators. So this displays the actual patients who have those indicators associated to them. So some indicators will populate on patients automatically based on system logic, like the new admit indicator that automatically does that. And if that is one you have set up for the daily assignment summary screen, that will show here. And then we have other indicators that have to be added manually to patients when the list maker is on the census screen. And an example of that is, again, Chad mentioned they want to call out their H&P needed patients. So they mark those patients on the patient census manually, and then those will pull on to this screen. What this shows, obviously, is we're listing the actual patients, their room and bed information, and the provider that they were assigned to.
And I just want to add here, and I think Chad really spoke to this, is the snapshot is really making it easy for the provider to prioritize their patients. So that's kind of the main piece here with this indicators and callouts. And we really find that this is making the summary more actionable because it provides the doctors a quick and easy way to see who those patients are.
Exactly right. Like you said, this output is configurable, so they can decide which patient types matter most to them. And this is really what makes this report different. It's not just a big list of all the patients for the day. It's highlighting the patients that are most important to the group in the morning and making it really quick and easy for the providers to see and get that information. And the final section at the bottom is our crossover notes section. So this section is designed so it can be used by the day shift or the night shift or a combination of both. Again, like Chad mentioned, at their site, they have a lot of nocturnists who are making the list in the morning. So every night at 7 p.m., this whole screen will clear, giving the nocturnist the ability to add any patients that they want to put crossover notes on. And then, so anything from 7 p.m. until the morning when, you run this report, all those patients will show up for that morning report. And again, the intended purpose of these notes is to call out important information for those day hospitalists. Instead of keeping notes in other places and having to retype them in that morning email, you can just do it one time right in this crossover notes section, and keep that rework to a minimum. And just to call this out again, this is not meant to be a replacement for documenting in your EHR. You don't need to put a note on every single patient. I mean, you can if you want to, if your site feels like that's how they want to communicate. But it's just for what is important, what is going to help those morning providers prioritize their list. Okay. Now that we have reviewed the whole screen and all the different sections, let's talk about how we get the report out of this and to your team. So you can see in the top right corner, we have the option to download. We have two different formats. You can download a PDF. And you have the ability to attach that to an email. You can print it, whatever you prefer to do. Or you have a Word document option. And let me just pull up. So when you download it, here's the Word example. This is what it looks like. So it looks very similar to the screen. It's got all your information. And again, like Chad mentioned, for them, they prefer to keep this in their email. So we have made this format really easy to copy. I just want to show you, copy and paste into an email. So if I copy this from Word, I can paste it into an email and I think the format looks really nice. They have the ability to add any additional information that they may want to convey. And then, you can email it to whoever you want to. If you have, like predetermined group email lists, you can use those. So that's really great. And what's nice is this keeps the distribution inside those existing internal hospital networks, and avoids, having to recreate any of this information manually.
Thanks, Jacqueline. And that kind of flew by. So if you're interested in adding the daily assignment summary to your workflow, you can just reply to the follow-up email that you'll receive or reach out to us directly, and we can talk you through some of the next steps. I will just say that as part of the implementation, our team will help you configure the snapshot and report to fit your needs. Things like which sections you want included, which indicators you plan to call out, and how you want to share it with physicians and staff. So now we'll just move into the Q&A, and we may be able to give you back some time here. Don't leave us just yet. First question, Jacqueline, what if people want different summaries for different groups? Some teams might need less information.
Yeah, so this is flexible. We designed it to help just generate that output and not be super rigid. So like we kind of had mentioned before, if you just want to use the provider summary, you won't have any of these call outs. If you just want to use the crossover note section, you can do that as well. really anything that we've showed you, you can configure and just use one piece of this, or like we said, 2 or 3, all the different sections. So you can tailor it to include, whatever your site wants and however much detail they need.
Okay, great. And the next question here, you kind of spoke to this, but just wanting to hear it again, is what happens to those crossover notes after they're used? Can you just kind of speak to that one more time?
Yeah, so the crossover notes, let me pull my screen up so you can see it again. So the crossover notes are intentionally temporary. So they appear, like you can see on my screen, for the morning's summary. So you can print it and they can be sent out. But every night at 7 p.m., this whole screen will clear. And we do that because that's the typical shift change from your day providers into your night nocturnist providers. And just to reiterate, they don't go anywhere else. They don't get sent to your EHR. They don't replace any EHR documentation. They're meant for that important call outs and help with prioritization in that morning communication.
Great, thanks, Jacqueline. We'll take this as the last question for today. Do the nocturnists need to have access to Medaptus to log crossover notes?
Yes, they do. Yep, so they would come in here. On my screen, you can see I have a user who has literally every bell and whistle that we have. But we could have your nocturnist just have the daily assignment summary if that was, their sole purpose for being in here. And they would be able to come in, and again, any patient they wanted to add a note, they would be able to click add, search for that patient, and then put that note in there.
Okay,
But yes, they
thanks.
do need to log in.
Okay, it looks like we actually have one more question, so I think we have time for it. We'll ask this one too. How long is the information on the report available for? Does it give you a range to pull the information, or it is cleared daily?
So we actually thought a lot about this. And for this first iteration, it's just going to be there basically for that one day. So if it's 7 a.m. in the morning and I do my assignments and I come to this screen, everything's going to pull on this screen. My notes, if there was any from the nighttime, they will show up here. Also, I just want to make sure I'm pointing out nocturnists don't have to do this. If that's not the way your hospital works, that's totally fine. Maybe the list maker has notes that they themselves want to put in, and they can sit down and add 5 patients at a time in the morning in the note section. That workflow, you don't have to do it that way, but we wanted it to be able to be an option. So that information will stay. You'll print this report in the morning, distribute it. This will sit here for the rest of the day until 7 p.m. And then this whole screen clears. And I don't have a picture of it, but we put a little, some words on the screen that basically says, 7 p.m. All things added to this screen moving forward will, be available for tomorrow's report or something like that. So it's clear why the screen has, then now blank.
Thanks, Jeff.
Sorry, I just want to say that if people are interested in having this as something that you can go back and you want to pull up the report from Monday, and it's Friday, that is something that can be added in a future state. So, if you're using this and you like that or want that, we're definitely open to any feedback that people have. So we can, continue to improve this.
Thanks for answering those, Jacqueline, and for the demo.
Sure.
Chad, special thanks to you for joining us today. We really appreciate hearing directly from you and your time when I know it's very busy. And also thanks to everyone for joining. Again, we just really appreciate your time and attention. If you did have any other questions, please follow up with us and have a great rest of your day. Thanks so much.